We've got time for one more pro talk before we begin. We introduce our closing keynote and the Minister of Health. So, c'est mon plaisir de vous introduire, de vous présenter Dr. Mathieu.
I have the pleasure of introducing Dr. Nadeau-Vallée for the Pro Talk this afternoon. Mr. Nadeau-Vallée is a senior resident in anesthesiology.
Anesthesiology. C'est difficile dans les...
It's hard to pronounce in both languages. At the University of Montreal, Dr. Nadeau-Vallée took social media by a storm to talk about misinformation online.
Monsieur Dr. Mathieu.
Merci. Merci beaucoup. Merci beaucoup.
Thank you for this introduction. Good afternoon, everyone. I'm a resident doctor and a scientist. I have 2 PhDs in the area, and I'm on TikTok as well. So I'll tell you a little bit more about this. For those of you who haven't been on TikTok or think that's an app for people to dance, it goes beyond that. It's an app where on the home page you have short video suggestions. Why it can be dangerous? Because if you look at a video for a long time, the app thinks you like that content and will generate more of the same type of content. People went on TikTok because they were locked down throughout the pandemic, and they watched a ton of videos and fell into the rabbit hole and watched a lot of misinformation, anti-science videos because of fear, and ended up being vaccine hesitant. And a lot of people died because they refused vaccination, which is why I went on that same app. Navigating on my own homepage, I had a lot of anti-vax videos. And for me, it was clear that this went against science. It didn't make sense at all. But when I went to the comments section, a lot of people defended science and a lot of people defended what they saw. And I decided to produce one video on TikTok to counter that message. So it started this way, from humble beginnings with these capsules. A Quebec nurse, she was a nurse at the time, said that physicians weren't disclosing side effects and the vaccine were dangerous. And I refuted all of this information. The second video, an actor from Quebec, Anne Casabonne, published a text on her Facebook page stating that vaccines were rubbish. And she referred to the fact that she was studying nursing, that she knew about vaccination, and that vaccines for COVID weren't real vaccines. So I corrected this misinformation. Once again, the video was popular. The third video, I talked about my experience as a resident. People who were healthy had COVID 6 weeks ago, and then what the information was circulating had to do with post-COVID symptoms that we had to pay attention to. And a year later, we know that post-COVID symptoms are a real thing. Now, I produced over 300 capsules on COVID and the virus, and I thought that this would solve the misinformation issue very quickly, but it wasn't the case. A few weeks later, I was invited to a popular Quebec talk show. I was invited, and I was very surprised to be invited. And now I have about 100,000 followers on TikTok. And I was even on a 2021 edition of an end-of-year review show on the television, the Bye Bye, with my mascot, Dr. Pikachu. And with humor, we can talk about science, which is why I think these videos were so popular. People weren't doing this just because they had to listen to science and out of homework or something. It was probably because of the humoristic tone. My name on social media is Walmart Justin Trudeau. That name came from the fact that I look like a clean version of Justin Trudeau. So I'll let you judge for yourselves. And I wanted to talk about the mechanisms of misinformation or phony experts. Just about every person who tried to improvise themselves as scientists. But now I focus on scientists and physicians who are spreading misinformation. And it's the most dangerous form of misinformation because people believe them because of their expertise or so-called expertise. And they can't make the difference between scientific information that is valid and misinformation. This is Alexandra Riancourt, who is a researcher in France, specialized in genetics, and she's going on social media saying that mRNA vaccines are genic technology that are modifying our genes. She's a credible researcher. She publishes extensively in her field of research. She's respected or was respected by her peers. So I produced a TikTok on her, taking a few excerpts from her clip, and then I pasted them with my own videos to compare the information I have, credible sources, and she has no sources to back what information she's spreading. And it's a way to tackle misinformation. The second video was like a film. This was during the pandemic, and a physician, another credible physician, said, I invented those vaccines. Don't take them. They're dangerous. They'll be terrible for humanity. I made a terrible mistake by inventing these. And it's scary, especially when you look at his reputation online. In the 90s, he was amongst the first doctors who published on mRNA technology. It was published in Science, PNAS, and his name is on most of the patents behind mRNA. His message can be scary. I was scared myself. At that time, I had 2 Pfizers, but I looked closer into it to see if there were any sources behind this. There weren't any. And I looked at his other videos. It was always the same thing that sounded like mumbo jumbo that weren't based on anything. And I produced another TikTok with my own information. He said that all children that would be vaccinated would die from it. And with a bit of research, I realized that he had taken 2 shots of Moderna. And I thought, well, if he really thought they were dangerous, he wouldn't have had 2 shots of the vaccine. And this was debunked on media by others afterwards. Christian Perron, who says that Lyme disease was caused by Nazi ticks during the Second World War. He has millions of fans throughout Europe and even in Quebec. So I produced a TikTok video on him. So another group of phony experts. And now I'm debunking Quebec scientists and physicians because unfortunately we have some here. Info COVID, as you can see on the picture here. This is a sub-branch of a French movement. It's called Info COVID Quebec. And on this YouTube video that was viewed by 500,000 of people in Quebec to say that vaccines are dangerous, that public health measures are useless, and that the virus was benign. They seem credible. Once again, they have their white robes, stethoscopes, microphones. They're in a solemn setting that reminds me of this image on the right, the Last Supper. And it seems like the whole thing was staged, in my view. Unfortunately, I wasn't able to produce a TikTok on this one, but I did publish a long article referenced with sources from the New England Journal of Medicine. One woman here even said that children were at high risk of dying from the vaccine. She was interviewed by journalists and she wasn't able to cite a single source to back her information. So this is the article I published. It took me 2 weeks. I was tired because I was on call all of that week as well. And once again, this was also debunked by Quebec scientists and journalists. This is a molecular biologist who works at University Laval. He goes on social media to say that COVID doesn't exist in children, that we shouldn't vaccinate him. Most of his sources go back to 2019 while COVID wasn't circulating, and that COVID had so at the time COVID wasn't circulating. It was during the peak of the lockdown and before children were vaccinated. This was debunked, and the University of Laval distanced itself from this researcher. So if you have time, you can go see my TikToks, Walmart Justin Trudeau, and if you like science and humor, I think you'll enjoy them. And what is misinformation? It's important to define it. It's somebody that is spreading false information, knowing that it's false information. It's deliberate. It's a lie. Misinformation refers to false information that is not intended to create harm. It might not be as harmful. This is an article that comes from Nature Communication and says that most people who are vaccine hesitant found their information on social media and the internet. And there's a direct correlation between the quantity of misinformation circulating on the web and vaccine hesitancy. This correlation goes both ways. If you reduce misinformation online, you can also reduce vaccine hesitancy, and it's an important public health measure. This is an example of disinformation that I found. Dr. Richard Marchand, who's works at the Institute of Cardiology in Montreal, and right before vaccination in January 2021, journalists asked him if he was vaccinated. At the time, not anybody had been vaccinated. People were busy. I didn't even have time to get my vaccine. He said, no, I haven't had time to do so, but I will go. And somebody published this a year later saying that Dr. Richard Marchand chose not to be vaccinated and was still hesitant. This is a deliberate message that is a lie, probably to promote an anti-vax agenda. This is a video I produced after an article on COVID treatments that said Paxlovid wasn't efficient and more expensive than antidepressants, and I tagged the editor-in-chief, and the day after that an erratum was published that was longer than the article. So that's another example. Part of my work is about debunking scientific publications that are published in credible sources internationally. Sometimes the peer review process isn't always foolproof, and some articles fall through the loop. And this article that said if you injected the COVID vaccine in certain types of cells, it could modify the DNA. And after my PhD in this field, I realized that these scientific figures were false. Another one here that said that vaccines had caused more deaths throughout the world than COVID. It was published in toxicology reports and has been retracted since. Another article that we're working hard to retract, stating that vaccines cause cancer, and it isn't referenced, and when it is, these references talk about COVID and not about the vaccine. It doesn't make sense at all. Another part of my work was to debunk brochures that were sent in, or that had been passed around in elementary schools. My child came back with this brochure from school last year. Another part of my work is debunking disinformation on masks. Believe it or not, some people think that masks cause or are harmful because of epoxy, and that they're not efficient because the virus goes through the fabric of the mask. I produced a TikTok and was invited to the news the next day. So here I am in my car on the news talking about this TikTok. the drawbacks of being on social media. It's important because it's a hot topic. You all remember the Freedom Convoy, people who were against the vaccine mandate, and I was insulted extensively. As you can see, somebody is asking me to take a bath with my toaster. Clown emojis, I see a lot of those. People are trying to harm my credibility. People are saying I'm prepubescent and too young for this. And somebody else went even further, created a website in my honor and saying that I got a scholarship throughout my PhD that was funded by Pfizer and that it was because I was being paid by Pfizer. So some people believe that I'm being paid, getting paid by Pfizer. The person included their source, Joe Lebu Facebook, which is a very serious source. And people created false images of me with false citations. And sometimes it's damageable because people believe that I really said these things. The second image shows somebody who said that on a popular reality show, I had predicted who would win it. And people also stole my identity to make false social media accounts. And some people might see right away that it isn't me, but some colleagues contact me to say that it wasn't very professional of me to have accounts like this one, and I had to tell them that those were false accounts. Somebody sent me this on Messenger anonymously that tried to recreate my apartment by watching my TikTok to say that I'm going to find you. I'll see where you bought your furniture and I'll find out where you live. And it's scary. I went to the police several times because of threats, which is why it's important to get support from my peers, the College of Physicians, the Canadian Medical Association, several immunologists that are following me, and it's which leads me to the positive point.
J'en ai reçu des milliers.
I received thousands of testimonials on vaccines, on TikTok, on Facebook. I didn't believe in this, they said. I saw your TikTok, and I decided to get vaxxed. Even one of those people was mentioned in the Journal de Montréal, and said TikTok, a doctor convinced me to get vaxxed. I was very proud, and that's really why I'm doing this. So there's been some valuable collaboration. I've met wonderful people who told me that they want to help me in what I do, pediatricians, immunologists, people who contributed their own know-how. In fact, we had some live sessions on TikTok together where we had tens of thousands of people who came to see us, ask questions. In real time, we were able to answer their questions. I asked immunologists, cardiologists, when it was time to talk about myocarditis, and they were there to answer people's questions. There's even a meme, I'm the guy with the little hat there. The media also help us when it comes time to send a message. When we have a tweet, the media will often get in touch with us by text and say, look, do you want to come to TVA? Do you want to be on this radio station to send a message? And that's helped us a great deal. Well, sometimes not all comments are negative. And somebody said here, you're not the Walmart Trudeau version. Actually, Trudeau is really the true Walmart version of himself. That was great. There are lots of memes. Here's TikTok Doc. And for those of you who've watched Games of Thrones, there I am, Terminator. I watched that when I was little. I don't watch tennis. I hope this is good. I don't know who this guy is, but all yes for vaccines. And oh my goodness, this guy, yes, is important. An artist in Trois-Rivières drew a rock in my honor, and I thought that was great. And as well, I made a friend. Somebody who I debunked myself on TikTok. He's not in the field, he's not a scientist or a doctor, but he had put posts and I debunked what he said and he thanked me for it. He said, I needed you to do that. Can we meet to talk about it? And we did a TikTok together. And there we are. So sometimes there's some good outcomes. So using social media wisely for personal wellness' sake is important. If you decide to use social media to talk about your research or to share your expertise, I think it's important, but there's some advice I could give you. Take breaks every 30, 40 minutes. It's really important for mental health. It's quite a destabilizing universe. It's also important to get fresh air, go outside and get some fresh air, and also retire from time to time. After the show, Tout le monde en parle, I retired. I don't know how many messages came in per hour every day. We reached out to 1 million people, and some 10,000 really hated my guts. So I took a month off at that point. And during the trucker convoy as well, I had to take a month off because the atmosphere was so tense and sometimes it was even violent. And don't forget that everything is amplified on social media. For instance, somebody who says that they want to kill you on social media, well, they might see you in the street and say, "Aren't you the TikTok guy?" And you say, "Oh boy, yes, I am." So using social media for the right reasons is important. It's what allows us to get up every day and do what we do. And I'm wondering, Mathieu, are you doing this for the right reasons? And when the answer is yes, I continue. And even today, people do need the right information in hand to make the right decisions about their health. And at a time when things are a bit dark, do watch Dr. Glaucom Flecken. He's an ophthalmologist. He's extremely funny on TikTok, so I highly recommend watching him. So that's the end of my talk today. I don't know if there are any questions or comments that you'd like to address to me. Well, that was wonderful. Thank you so much. And thank you for doing us this service.
And I think the number of hits on Walmart Trudeau have just gone through the roof. And I won't comment because I don't want to say anything inappropriate, but I don't think you look like Justin. Merci beaucoup, Monsieur.
Merci.
So thank you very much, Dr. Nadeau-Vallée. Thank you.